Can you take tirzepatide and retatrutide together? Please don't. And in this video, I'm going to explain exactly what consequences you may have to face if you do stack these. And I know there's a lot of things like on the Reddit threads, and there's people who are getting all fancy and, every 2 days I use low dose microdosing semaglutide, and then I'll bring in tirzepatide, and then over here I rotate in with retatrutide. It's nonsense. It's somebody just trying to be fancy and sell you something, usually at the end of the day. So do yourself a favor and don't stack these. I'm Regan Archibald, founder of Ageless Future, and our overall objective is finding the right data based on labs, your biometrics, and then determining what peptide is right for you based on what your goals are. So if you have the subjective goals of maybe you want to have better body composition, you want to have more stable glucose levels, then let's look at your labs and let's see what is the best peptide to get you there. Is it tirzepatide? Is it retatrutide? If your goal is more performance enhancement, longevity, great metabolic function, you want kidney protection, cognitive protection, you want protection for your heart, and your pancreas and your liver, let's talk about why retatrutide may be better than tirzepatide. So think of retatrutide as more of a performance enhancement, more body composition where you're going to hold on to muscle, you don't seem to lose as much. But think of tirzepatide more as like the appetite control. So if your appetite is just crazy and ferocious, then we may want to get you on tirzepatide in the beginning just for the satiety impacts of it, because it does have a stronger pulse on the GLP-1 pathway, 2 to 5 times greater, depending on the dosing that you're using. So retatrutide, why do I love this peptide? I've been using it for 2 years now, but one of the things that I really appreciate about it is it does seem to help on my cardiovascular fitness. And that's something I love: mountain biking, I love skiing, snowboarding, running, hiking, all these things. These are really fun sports, and they do require a pretty robust amount of cardiovascular fitness if I want to do it at the level I do it. And it's nothing impressive, by the way. For me, it's how I have my fun, how I spend time with my family, my friends, and it's also what I love doing alone. So when it comes to retatrutide, here's the benefits. And these benefits, if you think about your liver, one of the things that's happened in our society is this thing called NASH, or non-alcoholic steatosis. And this is where you get fatty liver disease. In the studies, it was published in New England Journal of Medicine in 23, what they found in patients who were on the highest dose of retatrutide, and that was 12 milligrams weekly, they lost 24.2% of their overall body weight. But what they also found is they had an 82% reduction in liver fat. And so that's just like breathtaking, because if you think about your liver is the most active organ in your body, one of the most active. Your brain consumes a lot of the energy. Your brain's pretty amazing because it's using 20% of the overall electrical energy in your body when you're awake, 25% when we're asleep. But your liver, it's a detoxification agent. It's like an airport where all the hormones come in and they get metabolized and broken down. You've got all your digestive processes that flow through the liver. And when you get a fatty liver, a lot of times symptoms don't show up. You may see it in your AST and your ALT on your lab markers. You might see your GGT start to increase. But by the time you become symptomatic, it's too late. Like your liver loses about 90% of its function, or you can have a liver that's got up to 90% fibrotic before it really flags a blood test. And this is where people are pretty shocked when they do a full body MRI and they're told they have fatty liver disease and they don't drink alcohol. They have a fairly clean lifestyle, but there's other confounding impacts of it. So when you take retatrutide, the difference is it's got glucagon in it. And so for those of you, I've got asked this so many times, we got to do a video on this, because if you have retatrutide with tirzepatide at the same time, you're going to have some very severe consequences when it comes to nausea. Both of these are GLP-1s, and if you're overdosing on the GLP-1, you can end up with pancreatitis. You can have gastroparesis. So that's where your whole digestive system, the stomach freezes up, and you can't move food through it. And I've worked with several patients who've had this, and it is not fun. I mean, it's so painful. You can just imagine like the worst gas of your life, and is there all the time. And then at the same time, you're starving. Your body can't get the nutrients that it needs. So do not stack these, and don't get fancy and try to stack these microdoses several times throughout the week. If you're going to do a microdose, what we classify that as is once a week. And because the half-life, which I've got another video that talks all about the half-life of this, half-life is like 144 hours. So it's about 6 to 6.5 days. So then you want to move on to the next dose. But with the glucagon, if you're looking to compare retatrutide, tirzepatide, you will have more weight loss. If your goal is weight loss, retatrutide will get you there faster. If you're thinking about visceral or the ectopic fat, a lot of people forget that visceral fat that's the fat around the organs. And sometimes you can see people who look really fit, great shape, but their chest cavity is a little thick and there's a lot of visceral fat in there. And that visceral fat is what causes a lot of disease in the body. It's more dangerous than that fat that kind of jiggles, the fat we can see. What retatrutide does is it more preferentially targets that visceral fat. And if you want to get really black belt, you can add in like adipatide. And adipatide, you want to use it on short periods of time because it turns off the blood supply to white fat. But you can also do some cold exposure. What that does is it activates the mitochondria, so you can take this white fat into beige fat, and now you have metabolically active fat. But outside of tirzepatide, retatrutide, because of glucagon and because of the GIP, that GIP peptide is 8 times more in retatrutide than what you're going to get in tirzepatide. So what that means is you're going to have a much more robust level of insulin sensitivity. And then with the glucagon, that's where you're really driving in that thermogenic effect where you start transforming the fat and metabolizing it. And specifically, it does seem to target the visceral fat. The other big thing is when you think about body composition, a lot of the skepticism that I've received, and a lot of times people will turn their nose up like, oh, I don't want to cheat with GLP-1s, like I just want to lose weight naturally. Well, one of the things that you'll find is the GLP pathway is broken. And with tirzepatide, if you activate it too much, you could have side effects. So there's a reason why people are trying to steer clear. With retatrutide, you're not going to have the same side effects. The secondary thing is people will be frustrated. The skeptics will say, all you're doing is losing muscle. And they'll take these studies where, somebody is morbidly obese and they'll say, look, they lost 100 pounds, but 50 pounds of that was muscle. And it's like, well, yeah, we don't know if they made any lifestyle changes. We believe you can't out peptide or out hormone or out stem cell sedentary lifestyle. You want to make sure you're fixing these things. But the other benefit of using retatrutide is because it's more performance enhancing and because you have the glucagon side, you'll hold on to muscle. You won't lose muscle. You'll preferentially target fat. So it's far more advantageous globally than you would find from just tirzepatide. So absolutely don't stack them together, but if you need to choose one, choose retatrutide. Seems to be really helpful. Just a final note on this, if you're someone who's of the camp of, I want to lose weight naturally, I love that, and I think it's really important. It's really important to have the right lifestyle to go along with any of the things we've talked about today. But the thing that they found in the studies is that people who lost the same amount of weight, same aged people, lost the same amount of weight when comparing the biomarkers, so looking at all the blood labs and some of the other biomarkers like their frailty scores and things like that. People who used GLP-1s and they lost 20 pounds versus someone who lost 20 pounds naturally, the people on the GLP-1s had better cognitive scores, better kidney function, they had better cardiovascular scores, better blood sugar. So take it for what it's worth. But at the end of the day, I appreciate you guys being part of this community. I make these videos so that you can get clarity on where you want your health to go. For those of you who want to go deeper and understand more about retatrutide, you're going to want to watch my video on how to dose retatrutide. I'll see you on the next video.